Oregon lawmakers are considering major changes to the state's foster care system. A proposed bill would allow Oregon to once again send kids out of state for treatment, just a few years after Oregon stopped that practice because of abuse. The legislation has Governor Kotek's support. Evan Watson joins us in the newsroom to break it all down. Evan.
Tim, the bill's supporters say it'll help foster children access behavioral health care, but many opponents say it's just winding back the clock. That includes Sheila McGonigal, a former Oregon foster kid, who tells me this would be regressive.
There were so many reports of these kids being abused and hurt. We fast forward and we want to repeat history.
Sheila McGonigal knows the life of a foster child.
I was in that system 60 years ago and aged out in 1979. It's horrible that it hasn't changed since that time.
When you say it hasn't changed all these years later, what do you mean by that?
They're suffering the same trauma as I did.
She's against Oregon House Bill 3835, a detailed package that would allow Oregon to once again send foster children out of state for housing and treatment.
They send these kids out of state and they become forgotten children.
Oregon stopped that practice in 2019 following reports of abuse. McGonigal says there's nothing in this bill that convinces her that accountability or oversight would be better this time around.
They're going to have someone checking on this foster child every 15 days. Okay, it didn't happen before. What changed? What's changing? They've got extra employees? Don't think so.
But the foster care bill has prominent backers, including Governor Tina Kotek, who says it's unacceptable that foster kids are staying in hotels or emergency rooms when they could go elsewhere.
We know that too many children in our state have acute behavioral health care needs. We know our current system needs repair and is failing too many children. The status quo is unacceptable.
The bill would also narrow definitions around wrongful restraint or seclusion of children. A child psychiatrist at OHSU testified that medical providers are currently working in fear that they'll be accused of abuse.
There are many reports of potential abuse or neglect that are not founded. Each one of these reports causes the person to be anxious, fearful for their jobs and their livelihoods.
Governor Kotek saying providers need direction.
Let me be clear. I do not support inappropriate restraint or abuse. What I do support is a system with strong crisis intervention training, clear and practical guidelines, and accountability. We want providers to know how and when to de-escalate.
But McGonigal and others.
It is just not okay. You know what? They deserve so much better than we're getting.
Believe these changes would take the foster care system backwards. McGonigal wants a different approach.
I believe we can find the resources in Oregon. We need to have people who are tenacious and ambitious, and they want to find it for these kids. They deserve that much.
For years, Oregon DHS officials have said they struggle to find adequate places to house foster children because there's a lack of available foster homes and residential treatment centers. DHS supports this bill. A public hearing was held this week. It's yet to be scheduled for a vote. Tim?
Evan, thanks a lot.